Okay, we're going to start now. So thanks again, guys, for getting on. We really appreciate you. I think it's going to be interesting. I'm sure you're going to walk away with some sort of information that's going to be beneficial to you. My name is John DePello, for those that just got on, and I have the wonderful opportunity of speaking with you. I'd like to just go over some of the things that we feel would be important to note about where we think home care and home health care and just generally the care for people in the home is going. In addition to that, we want to talk about what we're doing, which is unique and different. It took us many years to accomplish. So let's start out with several things. One, why we're different. We feel that we're different because we're able to provide services, we're able to do certain things based upon what we've accomplished over the last 25 years that others are not. At least bundle those services and really create what we call a continuum of care. What we're focusing on is a lifetime solution for in-home patient care. We feel that a patient is one of which really requires dedication and devotion and wants that on a continuous basis from caregivers that they feel very comfortable with. You know, they should never have to go to another solution for care in the home. We should be that one solution. Okay, where are we going with home care and home health care? Where is care in the home going? Well, for one thing, we all know and experienced what the downsides, many downsides of the COVID epidemic and pandemic actually took place, and you know what occurred as a result of it. And I think the reality of it is that we now focus more on home care than ever, home health care than ever, and I think it's gotten the eye and also gotten in the pocket of the federal government. So their subsidies and what they'll be doing going forward will be zeroing in on care plans that require really the emphasis of different types of approaches in the home. We'll talk more about that in a moment. Well, the overall demand for community-based care will grow substantially over time to come, period. But if we just look at the baby boomer generation in the next 5 or 6 years, presently we're at 48 million baby boomers. Will probably zero up at somewhere around 74 million baby boomers. That doesn't include those that are a little older, or those, of course, the younger generation. I consider anything from 65 and down. So you're looking at a multitude of opportunities, and home health care and just the care itself of a patient in the home, if anything, it would be considered recession proof. It would have to be having an opportunity to have an abundance amount of opportunities to serve, one that will be inevitably probably at a position where there'll be too many people to take care of. Patients, well, families, they prefer to be cared for in the home. You know, I think the future is growing in that area. I don't think there's anyone that would deny being in a facility or in the home. What would be better? The home is an least costly setting, you could say. I think between hospitals and long-term facilities, caring for someone in the home would be probably the most affordable approach for post-acute and long-term care. Question I have for everyone is about the home healthcare industry. Presently, does the home healthcare industry have the knowledge and the infrastructure, I say infrastructure, needed to support emerging models? These emerging models that will be necessary, and as we look forward, we'll talk more about them in the delivery of healthcare going forward. The future of healthcare. But we feel the future of healthcare, the future is really going to be based on a hospital type approach, a hospital at care, home care model. Presently, it's actually being done. Hospital at home models enable most patients who need an acute level type of care or post-acute or even long-term care to receive care in their homes rather than in a hospital or nursing home. You know, to think about this, we really need to start to think about innovation. The innovation going forward that will be required and necessary in the home environment. Aligning with that innovation, aligning with customer preferences. The future of home healthcare is based on a model that delivers in three ways. One, of course, personally, and then there's going to be other ways, and we're experiencing that. And COVID helped us experience that in a very big way. It's not going away. If anything, it's going to grow, and it may take over the personal care setting to some degree, and that's virtually. In addition to that, through technology. The interesting thing about our existence and where we're at today and how we can work with this hospital at home care model. Home care for the 21st century is very different. And I'm going to explain to you that. I'm going to explain that to you in somewhat detail in a moment. All right. So I want to talk about home care for the 21st century in a sense where what we bring and how we do what we do and why we're able to do what we do. For one thing, we have over 25 years of experience, and our parent company, 21st Century Healthcare Consultants, second to none. We're known in the industry as the provider of superior home healthcare consulting and services. The interesting thing is, by God's good grace, we've been blessed over the 25-year period. We've opened up over 9,000 home care and hospice businesses throughout the country. Doing the math, that probably amounts to somewhere in the vicinity of a third of what is considered opened right now. Another thing is that we have a team of 50 healthcare consultants. We have consultants available. We have the infrastructure ready to support whatever it is we're going to do. In addition to that, we have in the vicinity, I think right now it's about 10 registered nurses. I will tell you that they're all CHAP certified, meaning that they're CHAP certified surveyors. That enables us a big opportunity to go in and to make sure, especially when we start talking accreditation, that everything is perfect for survey. Experts, is there such a thing? Well, I think we're considered probably pretty close to it. We're not new to healthcare by any stretch of the means. Why are we different is the key. When you talk about, a solution for inpatient home care, you really have to have a solution to take care of a patient with most medical conditions. We have to have readily available experts. We have to be known in the community as a provider of quality home health care servicing across the board. And we should be able to take care of a patient with whatever their needs are. Our in-home care solution can provide ongoing hospital type of care, not everything, but hospital type of care, and providing a solution for most medical conditions, such as hospitals can. Our continuum of care, well, it's like any other. Our care model, our care in the care industry, the care model is usually siloed to one or two types of settings, types of care. We include a multitude of businesses in what we do, and 11 different revenue streams. A multitude of options. We have a multitude, as you'll see. I think that, we have to understand how we do that too, because it is kind of interesting, but yet could be overwhelming. The best ongoing training and the best telehealth support in the industry. Let's talk a little bit about this for a moment, okay? We have 7 to 8 different business care models, which means business lines, which actually means dedicated businesses that we go and get licensed for and provide services for, and obviously amazing revenue streams. Those 7 to 8 different businesses, as we'll look at in a moment, don't happen all at once. What we do is we enter into one different business model. We focus on building that business. We focus on getting that business to a point in which the revenue return is one of which helps with operational costs, inevitably sustains those costs, inevitably becomes profitable. The goal is not to jump into many at once, but to master one, then move to the next. 11 revenue streams that are that offer high revenue opportunities. We provide higher standards of care with accreditation. We're a big believer in accreditation, whether it be private duty or Medicare accreditation. We're experts, considered experts in that area. That's where we began 25 years ago. Lifetime ongoing training and support services. There are many of those. We include all of our services in what we do. So what you're going to find is it's much more than business models and revenue streams. It's a multitude of services that you'll get, our support that will help you be successful. Patient care plans for pediatric patients to generic patients. That's our process of care. The best telehealth care platform in the industry. Everyone knows where we're going with telehealth. Everyone knows how important that is. And everyone knows that you need to have a great telehealth care platform, and we have it. A lifetime of unlimited training, our support, our ongoing training, our programs, everything that we do, whether it be here or at your agency on an ongoing basis, at least every 60 days, we provide. And a robust, innovative technology platform. All right, so let's look at this just for a moment and talk a little bit about what our revenue streams look like, what our business streams look like. Over the past 25 years, healthcare has been delivered in a silo. It's usually delivered in one specific way, maybe two ways, limited payer sources. Franchising today is really geared towards personal care services. Mostly personal care, as far as I know, maybe a couple that dabble into skilled. Multi-care options being paid on multiple revenue streams for one patient does not exist. With our program, we have the ability to be paid on multiple care plans, multiple revenue streams. We start out with companion and personal care. In most cases, that's where we begin. We know that companion and personal care is well needed. Probably the most opportunities are in personal companion care with helping people with activities of daily living. It's a fantastic revenue stream. It opens up many different opportunities for growth. What we know is the same patients we work with personal companion care, obviously, inevitably, will need skilled care services. So we want to have the opportunity to cross them over, keep them, and work not only in the personal companion care area, but also in the skilled care setting. So the next one would be private duty skilled care. And again, that's another licensing opportunity, another business opportunity. And along with that comes Medicare skilled. Most case scenario. Any particular patient that's out there right now, whether it be working through some sort of payer source, whether it be long and short-term insurances or waivers or veterans programs, whatever that looks like, we want to have the ability to take care of them and get paid. Also, Medicare certification and accreditation. We take you through that process. Inevitably, you get accredited and then you get a billing number. So we have that as an opportunity, very, very big opportunity. As time goes on and we move forward in the healthcare industry and the streams of healthcare, we see all the rest. So, hospice care becomes very important. We are experts in hospice care and getting accredited in that area. We employ several hospice former directors of operations. We work and we get you certified for hospice as well. Non-emergency medical transportation can happen in any of those areas. Transporting the patient is another lucrative area. And you know what? We should be able to be business-minded, have a business area in that way, and get paid for that as well. Durable medical equipment, having the ability to be paid for equipment. And, the patients need equipment, whatever that looks like, and maybe having a small business setting in that area as well. Staffing is very big in the industry. So we open up a staffing business that supports any of the caregivers, aides, nurses, whoever we have, so that we may be able to provide staffing contracts to some of the bigger organizations in your area. Other different revenue streams. We're experts. Our nurses are experts in the area of infusion care, wound care, pediatric palliative care. So we look at these as business revenue streams. We also look at them as opportunities to be known in the community and to provide specialty care services, kind of a differentiator, so to speak, than what might be available with all the rest. Remember now, just so we are clear, we don't do these all at once. We gradually get to them as the agency progresses and grows the business models that we're focusing on. So, other things to note, we have a lot of support services. Unlike most companies that charge you extra for all of these things, we don't. It's all included in our fee. You know, I'm often asked, how do you do this? I mean, how do you support all of this at the fee that you charged? And well, the answer to that is that in our parent company, with our parent company, we do it already. There's nothing that we have to think about that I will tell you that we're going to figure out or find somebody else to do. We do it. We do it here. As a matter of fact, some of the larger franchises that are out there today employ us to work with their customers, and we charge them for these services. With us, it's all included under one fee. One, licensing for the models that I told you, wherever applicable in your state. We do that. We also do and support license renewals. And this is ongoing for years and years to come. Policy and procedures, operational materials, all of those things. Most of what I just told you will require policy and procedures and operational materials. That support is there. You'll have all of that, and you'll have any kind of updates that usually occur every single year. So you'll always be compliant. Credentialing, provider enrollment services, very important. We look at what's available in your area. We look at the best enrollment type of credentialing services for patient referrals or patient payment sources. If you take care of a patient, you need to get paid. You need to be credentialed. If they're in an insurance type company situation, if they're in a Medicaid waiver, if they're in a veterans program, if they're on workman's comp, goes on and on. We have a department dedicated to that. There's, I believe right now, 5 people that work in there, and all they do is this all day long. That is included in our services. No one else will do that. Ongoing training. Ongoing training is very important. Getting better at what we do comes through knowledge. We believe in knowledge. We believe in training. We believe in support. We believe in being the best. We also believe that we need our agencies to be the best for a lot of reasons, of which one I'm going to explain in a moment. So ongoing training is included. We have Home Care University that's included. We also have dedicated training at your agency. I'll tell you about that in a moment. Recruitment. We have recruitment platforms. We have recruitment programs. We have recruitment bonus programs. Goes on and on. One of the challenges in the industry is finding personnel, right? We know that. Well, we also know that there are solutions for that. And we support and help you with the recruitment of those that will be in your infrastructure. Marketing. There are marketing packages readily available. We're a marketing package that has everything that you would think of, or mostly I would think, of everything that you would think of if you want to do any type of campaigns. Readily available. All you got to do is just change a little bit of it to support your agency, and we're ready to go. Sales. Well, yeah, patient resources, right? How do I get my patients? I know that question comes up all the time. How am I going to get patients? Well, for one thing, you're going to have to get off. You're going to have to get up. You're going to have to go out there, and you're going to have to market to your community. But here's what I'm going to tell you, and no other company will. You're not going to be alone doing it. We have a dedicated team. Somebody will visit your agency. Somebody, probably Michael at this point, he'll visit your agency. He'll work hand in hand with you. He'll be in touch with you every week. He'll go out and he'll visit your referrals with you and make the presentation. We'll teach you firsthand how to do it. And then we'll follow up with you with it. So sales is very important to us, and we want to make sure that you get patient referrals. Day-to-day operations, we have the support internally for that. We have an amazing controller here that will go over your business plan with you. We'll also go over your budget. We'll make sure that you're staying in line, make sure that your budget is projected correctly, and make sure that your revenue and your spending is not going to put you in a challenging position. So we help you with that. Remember now, everything I told you, all the different models I just mentioned, business models. Here's another very important one that we're real excited about, and that's territories. Where's my service area, so to speak? Our objective is to create 350, at the very most, 400 super agencies, with everything that I just explained to you. Most companies out there today have in the vicinity of 1,200, maybe more. Not necessary for us. What we're more focused on and what we really care about is the agency success and that you're successful. We need to make sure that we have multiple revenue sources, multiple types of businesses. I can take that 350 and I can times it by 3 easily because I have so many different businesses that we offer that you'll be engaged with. Our locations have a multitude of opportunities to begin with. Most of the better ones are gone, but we still have primarily quite a few really good ones. And also the geographics of it become important. We look for in the vicinity of anywhere from 60, 65, 70, at the most 80,000 seniors, which when projected in just a general census is probably closer to 500,000 to 600,000 people. Somewhere probably in a radius of maybe 30 to 40 miles. And we work well hand in hand with all of our franchise partner families where we can work very closely with patients. So there should never be a patient that we have to pass up on. All right, so what is our ongoing cost? Our ongoing cost is as follows. It's a one-time initial payment. Now we put $49.5 to $69.5, but in reality it's probably closer to $69.5. It's $49.5 if you're in a state that is very limited. We have some states out there that are limited in what you can do. So in those case scenarios, it's less money, of course. But looking at that $69,500 might look like a lot of money, and it is, but not for all the services we offer over the timeline, which we project to be lifetime. So when you think about it, you wonder, at least you should be wondering, how do we sustain our operations just by charging that for the timeline that I just mentioned to you? Lifetime. It's not about what you do today that really is important to us, like giving us $69,500. What is important to us is that we find the right partners, that we find people that are really engaged in healthcare and home care, that want to make a difference in their community, that are passionate, that are ready to go out there and make it happen with our help. What's really important is that those people that decide to join our family and become one of our partners, as I call it, because I believe this is a partnership with a franchise, that person or persons wants to be successful and wants to grow. We have to grow. It's all about a multitude of businesses that provide a continuum of care. So we have to be prepared to do that. We have to be the home healthcare business model in the industry. What we're looking at is your success. We derive our success from your success. So like all of a franchise business that might be out there, there's a revenue participation that we're engaged with you. So we participate in 6.9% of your revenue, and it declines the more money you make down to 5.4%. So we have a declining revenue share, so to speak. That's how we as an organization will become what we feel we can be, and that's the best in the industry based upon your success. Guys, we have on the phone, on the screen here, important information. I'd love for you to go on and visit our website. You can learn more. It's homecarefor21stcenturyfranchise.com. I'd also really appreciate if you called us, if you spoke with us. And personally speaking, I'd love to speak with you also. And we can talk more about how we do things and maybe do a deeper dive and do a discovery day with you. But now, what I'd like to do is I'd like to open up for some questions. Okay, let's see if we have any. Let me go on and take a look. Oh, okay. Rosa. Hi, Rosa. Rosa from Ohio. Her question is, what are the additional costs for services you provide? Okay, well, that's a great question. All of the services we provide, first of all, are all included. The only thing that you're going to pay for is if there's any required fees, like, for example, a licensing fee or an accreditation recertification fee, which has to be done every 3 years. Those are the kind of things, but we provide all of our resources internally, all our services, no additional cost for that. The additional fees, it's that revenue share that we will have, which will decline from 6.9 down to 5.4% of your revenue. That's where we'll actually be engaged for everything that we're doing in terms of our services. That's what it is. Okay, so what's the next question? Let's see. Hey, Alex. Hello, Alex. Alex from Tampa. Do you provide resources for getting clients? Okay. That's really difficult. That's really, if anybody tells you that they provide resources for you to get clients, I'd question that. All right. I don't believe there's anyone out there that can do so. And if so, well, I'd wonder how. Anyway, here's how we do it. Yeah, we help you, okay? And we do it the right way. What we do is we send somebody to your agency. That person will go with you. You'll arrange some appointments. They'll make a presentation. They'll show you how to make the presentation. They'll teach you. They'll work with you. They'll even follow up on some of the opportunities that we have as a result. And you'll also have to follow up. And that's together how we'll get patients. We're the only company that does that. And we believe in a support process that enables us to be actively involved, doing the things necessary that we say, okay, you should do. Well, you know what? Let's see if we can help you with that. The next question, LaShonda. Okay. Let's see what LaShonda's got to say. LaShonda is asking, do you accept grant money for payment? Do we accept grant money for payment? Yes, absolutely. We accept grant money for payment. And matter of fact, Stephanie, our controller, is very familiar with a lot of these resources that are out there. I think you might find it beneficial. Give us a call, see what we know. Use the knowledge that we have. We can only hope that you be impressed and you want to continue and be part of our Home Care for the 21st Century franchise. So the answer to that, Lysandra, is yes. Next question. Next question comes from Doug. Hello, Doug. Doug says, Doug's in Washington. Are you doing business in every state? Yes, we're doing business in every state. Caveat to Doug's question, are you doing business in Canada? We're in process of doing business in Canada. We're not quite there yet. You know, we want to focus on the U.S. We want to focus on what we know best, where we've opened up over those 9,000 agencies I mentioned to you. I think that's where we want to be right now. And then we might approach Canada later on down the line. But good question, Doug. Thank you. And you know what? Let's do one more question. Let's see. Lindsay. All right. Lindsay is from California. What part? San Francisco? Hi, Lindsay. Nice to meet you. Yes. Okay. So what is the ideal candidate for a franchise? Interesting question. Well, you know, I kind of go back to what would you think an ideal candidate would look like? You know, I think obviously, ideal candidate would be somebody in the healthcare industry, somebody that's familiar, somebody that has some experience in knowing how, right? Somebody that understands patient needs, but not necessarily absolute, okay? We're looking for someone that is driven. We're looking for someone that's willing to do whatever it takes, as you should if you're going to open up a business. We're also looking for someone that is dedicated and ready to go and market their business, to get out in the community, to know the community, to work with the community. All of these different things amount to what we're looking for, but I think a better discussion would be a one-on-one. Let's talk about it. Let's see if it's a fit. I can tell you that there might be possibilities where we might talk to people and it might not be a fit. We're not looking to sell. I'm not interested in selling franchises. That's not what this is about. What I'm interested in doing is taking on the right franchise opportunity partners, people that really want to be part of this, and it's going to be something special, I promise you. In 5 years, our vision is to be branded as the go-to solution for in-home care servicing needs. That's what our vision is. And we will get that vision. We will make that vision happen. So I've said enough. I think I've gone through this presentation, and I hope that you learned something from it. I also hope that you'll come back to us, and I hope that you'll call us. I hope you'll email us. I hope that we'll be able to talk further about it with you. Also hope to find some really good people that want to join the organization. Thank you. God bless you. Let's continue. And we want you to go on our website. It would be great if you did that, and you can learn more. Thanks.